I'm Dr. Sumina Reddy, and today we'll talk everything you wanted to know about freezing eggs or oocytes. So stay till the end of the video. Egg freezing is also known as oocyte cryopreservation. It is a procedure in which eggs are removed from the ovary. They are frozen and stored for the later use. So later, when you are ready for the pregnancy, the eggs are thawed. They are combined with the sperm in the laboratory, and then the fertilized egg or the embryo is put into your uterus for the pregnancy. Now, this means that after the egg freezing, you will definitely need an IVF to become pregnant. There is also a term called as embryo cryopreservation. In this, after removing the egg from the body, the egg is fertilized by a sperm in the laboratory, and now the embryo, that is the fertilized egg, is frozen for later use. So what is better, egg freezing or embryo freezing? If you are married, embryo cryopreservation will give a better pregnancy chances. But in case if you are not married or not sure about your partner, then it is better to go for egg freezing. When should you go for egg freezing? First, in case you want to delay your childbearing for any reason and you might be worried that your ovarian reserve is falling. It could be because you're busy in your career or education, or maybe you have not found that right partner as yet. Second, in case unfortunately somebody is diagnosed with cancer and require treatments like chemotherapy or radiotherapy that are toxic to the eggs and sperms, we always recommend egg or sperm freezing to be done before starting these treatments. Third, in case you're at risk of premature ovarian failure, that could be because of a history of early menopause in your family. Maybe you're heading for an ovarian surgery which might decrease your ovarian reserve, or certain chromosomal abnormalities like Fragile X syndrome or Turner syndrome, which also are at increased risk of early menopause. What are the tests that need to be done before egg freezing? First, a test called as ovarian reserve testing. Now this is done by doing a blood test called AMH or anti-Mullerian hormone and an ultrasound on day 2 or day 3 of your cycle to check for the antral follicular count. Now these are small budding eggs in the ovary. These two tests together let us know the quantity and quality of eggs which are available to us, and to predict the response of the ovary to the fertility drugs which will be used in the ovarian stimulation for the egg freezing. Secondly, we want to screen the woman for infectious diseases like HIV, hepatitis B and hepatitis C. So now let's understand how the egg freezing is done. This has basically got 3 steps, that is ovulation induction, retrieval of eggs and freezing of eggs. Ovulation induction. When the period starts, typically on the day 2 or day 3 of your cycle, drugs are given called as gonadotropins to stimulate the ovary to form multiple eggs. These follicles typically take around 9 to 12 days to finally mature. You would have to go for regular follicular studies, which is done through ultrasound scanning to see how these follicles or eggs are responding to these medication. And then finally an injection called as HCG injection is given to achieve the final maturation of the oocytes or the eggs. The second step is retrieval of eggs. Once on the ultrasound we find that eggs are mature and ready to be harvested. Now the patient is taken into an operation theatre. This is a procedure which is done under anesthesia. An ultrasound probe is put into vagina to locate the mature follicles. Then a fine needle is guided into the vagina and into the follicles, and the eggs are carefully sucked out into the laboratory. Here in the laboratory, after identifying the eggs within the fluid, they are frozen immediately to sub-zero temperature, which is minus 196 degrees Fahrenheit. Now at this temperature, all the biological activity in the living cell is completely halted. These days we have advanced techniques like vitrification or using cryoprotectants for freezing. Cryoprotectants are substances which are used to prevent any freezing associated damage to the cell. Post-procedure, you need to take rest for a couple of hours at the hospital. It is normal to have a little bit of soreness and discomfort in the abdomen. You should avoid any unprotected sexual intercourse in the cycle after this procedure. You must immediately report to the doctor in case there is excessive pain, excessive bleeding, any fever, any difficulty in passing urine, or sudden swelling or sudden weight gain immediately after the procedure. If you think this video helps you or your friends, don't forget to like, share, or subscribe to our channel. Thank you.